Dr. Jonathan Tripp joining us in the studio this morning. We're coming up on 8:34. We're going to call it 50. Better Health with Tripp Family Medicine on News Radio 1310. KLIX and newsradio1310.com. Bill Colley with you, too. First of all, welcome back.
Thank you.
It-
Yeah, this is 3 weeks in a row.
Yeah.
I don't know if the listeners are liking this or sick of me. They're ready for one of my other providers, so I'm pretty sure next week it's somebody else.
But between you, Jeremy, and Lauren, you're all really friendly people. So I think that the folks tuning in every week they recognize that.
Yeah, when they come into the office and they look at me, they say, "You don't sound like Lauren." And some days I'm not Lauren. So no, she is awesome. In fact, our providers, I've said this probably before, but they are super smart. Lauren and Jeremy, I frequently am using them as our second or third opinion on a patient. And so it's not just them coming to me because I'm the supervising physician, but I frequently am going to them and asking, how do we best handle this? And sometimes it's all medical, and other times they're more of ethical issues. And they are very down to earth, ethical people and are always looking at it from the point of view of what's best for the patient, sometimes to our own, not demise, but our own detriment.
And who would think this too, that Lauren knows more about football than anybody else in the office?
Oh, she is a secret vault of knowledge. Yeah.
Yes, especially when it comes to the Vikings.
There you go. That's beautiful.
You wanted to mention the Peel Party, an announcement.
Oh,
about
that's
that.
right. Last week we did what's called a cosmetic seminar, which is just a free of charge get together. We had about a dozen people there, and that's about right. Sometimes we have 20, sometimes we have 10, but every single person plus an extra that was associated with one of the people there signed up for our Peel Party, because now they kind of see where we're going with this and how really we're talking about cleanup and what I would call graceful aging. This is not a matter of trying to make permanent changes to your face in a way that can be detrimental. In fact, I was doing reading last night about a lot of the fillers. And by the way, just so the listeners know, this is something we do every day. So like yesterday, I did Botox twice, and I did fillers to the lines that are next to your nose, kind of like your smile lines, and a little bit down by the corners of the mouth. And so this is something we do all the time. But as I was reading again, kind of past history on these, I really recommend against anything that says it's permanent, because you really can't tell what's going to happen to your face over time. You can predict, but you can't tell for sure. And some of these permanent things tend to drift from their position, leaving you deformities. So I'd really recommend anything that lasts more than about a year. I'd skip it, because 5 years from now you may have some detrimental effects. So if somebody especially comes from a foreign country and says, "Oh, this is a super cosmetic, doctor, and they're doing this special out of my home," run away, because those are the types of scenarios that people get crazy stuff like silicone put in that never goes away. And if it's done poorly, it looks bad right from the beginning. This is the old singer. Oh, I can't think of a guy from the Commodores. His wife and one of the, I think it's the daughter of Elvis Presley, got together with somebody that they thought was a super cosmetic person on a private consultation from out of the country, and they both just look like nightmares. So be careful who you go to. It does matter if you're going to the doctor's office. Even, in fact, there's a story right now about a spa called the VIP Spa down in New Mexico that the state health department in New Mexico is telling everybody, go get checked for HIV, hepatitis C, because they've had some poor practices of how they're using needles and fillers and whatnot. So be careful who you go to. That having been said, come see us. We're doing a Peel Party on September 20th. That's on Thursday. You do need an appointment. It is $100 a person. You're going to get about $400 worth of treatment. It's a lot of fun. And although you're getting a personal consultation, it really is more of a party atmosphere. We got some food, and you go through a series of different treatments, and at the end, you really find out that we're not doing anything that's going to scare you too hard.
And if they'd like to know more, just call, right? The
Yeah. Oh,
office.
please call our office. Yeah, it's area code 208. Um, what is my number? 933 4400. That is my office number, not my cell. 208 933 4400. You can also check us out on the web, which is trippfamilymedicine.com, or, as they say, stalk us on Facebook at Tripp Family Medicine. And we're happy to have your comments. And it's so nice to hear, from patients. I had a patient that I hadn't personally met, and he told me right away that he'd done some great review on us, and he's known in our office as kind of a troublemaker, and so to hear that he even put down a good review was a lot of fun.
We've got more coming up with Dr. Jonathan Tripp, talking wound care in just a few minutes. We're at 50 on News Radio 1310, KLIX, and newsradio1310.com. Better health with Tripp Family Medicine, and remember, life's too short not to feel good.
Because the pus was supposed to help get rid of what they called bad humors. And, basically what we think of now as bacteria or virus or whatever the attacking agent is by getting that pus, that's what's going to get it out. Well, pus to begin with is primarily your own white blood cells. So it is your immune system coming to defend you, but the fact that it's not there doesn't mean that it needs to be made. And so, but we're talking 1600 years, that was the belief. So, imagine people going to the doctor with a wound, and if they died because the wound got so infected that it caused a systemic infection, the belief was well, you were just already in trouble, and there was nothing else that could be done, rather than looking at it and saying, did we just kill that person? So laudable pus is laughable in our day and age, but we're doing things that will be laughable in 10 or 15 or 50 years or 100 years from now. And here's one that I grew up with. If you have a wound, you want to put iodine or betadine or merthiolate. Anybody remember the red merthiolate or
Even
mercurochrome?
came in a red bottle that my mother used to
Yeah,
use.
people called it monkey blood and things like that. In fact, merthiolate, which is an antiseptic, actually came in a tinted one and a non-tinted. And it was really funny because, my dad, who was not a physician, but, pretty, well-educated guy, would use the red because he grew up using that, and he knew if it didn't hurt, it wasn't working. And when you got the one without the tint in it, it didn't hurt. And so how could, he just couldn't make the transition to say it's the same darn stuff without a color in it, and it's the color that hurts. So, and he's getting this information from a physician at the time who was my grandfather, but he would not buy the clear stuff through my grandfather. He'd buy the stuff over the counter with the tint because he had that association of if it stings, it's going to get better. And so sure enough, growing up, I got merthiolate all the time. So what we find is merthiolate is okay if you have a dirty wound once. But, iodine, betadine, merthiolate, even soap, hydrogen peroxide, that's a favorite, how it foams up and everything else and cleans out the wound. Well, people will use this day in and day out, twice a day, for 10 days, 14 days, waiting for their wound to heal. And what they're really doing is slowing the whole process because each of these antiseptics are killing the new cells that are trying to heal. And so this is something that is relatively new. I mean, maybe 10 years old. I don't know the exact time frame, but it's the kind of thing that was kind of new to my trainers when I was in training, 10 or 15 years ago. So this is things that we're learning. And there's a whole study done by a group out of the Netherlands that gives some summary criteria of what to do with a wound. And I think that's really worth going over the details because it's simpler than you think.
Wise Choices, it's called.
Yeah, in fact, the commission is actually named, or the program is called Choosing Wisely Netherlands, and so it's evidence-based wound care, and then they produce a poster that says wise choices for an acute wound. And what's really interesting, it says, do not clean a wound, a sterile wound with saline. It says acute wounds only need to be cleansed when the wound is open and contaminated in dirt. In that case, it can be cleansed by rinsing it with lukewarm, drinkable water, tap water. This is really interesting because I was working in the emergency room over in Jerome about 5 years ago, and I had this guy who nicked his front of his calf with a chainsaw. So he not only had a cut, luckily he didn't make it to the bone, but he had a groove that had been cut out. And I was worried about it getting down to the bone because it was iffy. And I called Dr. McKee, orthopedic surgeon here in Twin Falls, who was on call for us. And I said, do I need, I'm worried about killing the normal cells. What do I do to clean this out? What's my best route? Should I use sterile IV solution, to clean this out because I don't want to infect it? And he says, you have an already dirty wound. He says, studies are showing that tap water is every bit as good as anything we use that's sterile. And now, even bone wounds, uh, the use of tap water shows no more infection rate than using sterile saline. So he says, just do tap water, clean him up, put a little antibiotic ointment on there, and, we'll see him in the clinic in a few days. And so that was a learning lesson to me, but that was relatively new information. And so this goes along with that if you have a wound that you created, you fell down, you cut yourself, whatever else, the main treatment is rinse it out. It doesn't even say soap. It's not even hydrogen peroxide or methylate and all those things we talk about. It's mainly water. If it's grossly contaminated, meaning like cow manure, then you probably want to use a little bit of a detergent, or you could use hydrogen peroxide once. You don't need to do this over and over because you want the wound to heal. So it says don't soak the wound in a bath containing a detergent. So you don't want to put it in soapy water, or it says you can use, if it's really grossly contaminated, either the iodine, and I mentioned the hydrogen peroxide. It says don't bandage, uh, well, step 3 is mostly about surgical wounds. So if you had little skin surgery like we do mole or skin cancer removals, and I've done that treatment under pretty much sterile conditions. You don't have to cover that up and keep that closed up tight. It basically, the closure itself is already clean, and you're gonna allow it to heal on its own. But if you do the cut, or you fall down, or you scrape your knee, this is when they say just tap water.
We've got a caller looking, I think, to chime in on this. And caller, you're on the air with Dr. Jonathan Tripp on KLIX at 851.
Hi, I've been told that having a dog lick a small laceration actually helps it heal faster. I was wondering if you could give some insight on that.
I missed it.
A dog who might lick a laceration, would it help it heal more quickly?
I can't tell you 100% on that. I've heard theories on it because absolutely dogs will lick their own wounds, and that is a way of keeping it clean. And you'd say, well, doesn't the dog have plenty of bacteria in its mouth? And the answer is yes. So there is a possibility of a contamination. On the other hand, if the wound is contaminated, the dog lick might actually be beneficial to cleaning it out some. I'd still go for the tap water. I have heard one theory that there is a higher component, and I don't even know if this is true, so this is hearsay, but that there's a higher component of vitamin C in dog saliva, and that might be the thing that you can attribute the healing from the dog licking a wound.
But I don't think you're going to have a kennel set up for your patients anytime soon.
No, we do some weird stuff. In fact, let me throw one out that I didn't put in this today is maggots. Fly maggots are some of the, shall we say, highest low-tech that's out there. And this is for debriding or clearing out dead tissue from wounds that are breaking down. They're called necrotic wounds. And so to get rid of that dying tissue, they actually will now, and of course they're getting these maggots from a lab that says that they're sterile and all this kind of stuff. I don't know how you get a sterile maggot, but basically they aren't allowed to feed on the cow manure and then come to the wound. I don't know. But I know that that is used and it's been used easily 10 years or longer, but it just seems gross and terrible from our perspective of how dirty that idea is. But it's a beautiful way to clear out a wound, and then be able to care for it, and they get rid of the maggots afterwards. But that's there are some gross things. So, the dog licking it, I've heard of worse.
You also wanted to mention number 4 here. This is probably one too that would surprise a lot of people.
Yeah, it says, you don't need to generally use expensive dressings. And some of these dressings are beautiful and cool looking, and they have a nice gel to them, and they do have some benefit for wound healing. But overall, they're saying, if you can get away with a little bit of gauze and maybe they talk about even paraffin, but like a coated in an ointment. Ointment would be like Vaseline or petroleum jelly or glycerin. Any of that is just keeping the wound slightly moist and keeping the gauze from sticking to it. So they're saying you don't need to put something that's fully bonding and adhesive, because the adhesive often is more of an irritation to the whole skin surrounding it. And sometimes, if there is a little bit of infection, your body takes care of it. But if you seal that with a dressing that is occlusive, now you set up an incubator for what little bit of infection is there.
Most people, I guess, today are told if they've got a cut, maybe after 2 days, take the bandage off and then just let it go from there. That
I think that's fair. Now, what's changing really recently is, for a long time we talked about having a dry wound. In other words, once you've had the Band-Aid on a day or two, get rid of it. Don't let it stay moist. Don't let it get infected. But what they're finding is not so much the bandage, but the what you're putting on it, like vitamin E oil, olive oil. A lot of people like coconut oil. These are things that are going to keep that wound moist. And cosmetic surgeons have known for a long time that vitamin E oil on a wound that was a surgical wound really helps it heal more nicely. So what they're finding is, if you have a wound, especially that doesn't have any obvious signs of infection, keeping it a little more moist makes that healing process go faster. I can give you my example. I freeze a lot of precancers on people's faces or arms or whatever, and my instructions are, you use an oil twice, 3 times a day, and keep that, because it's going to be a really superficial scab, and it'll stay kind of lighter brown, a little bit waterlogged looking. And on the face, in about 7 days, the whole thing will slough off, and you have a pink spot rather than going through a dry, cracking, potentially bleeding scab. And it brings out a much better cosmetic effect, because the chance of scarring is actually going up with that scab that keeps cracking.
Can I tell you a personal Jonathan Tripp story?
Okay, here we go.
I was out in the sun at an event over the weekend for a couple of hours, and when I got home, I looked in the mirror. My face was beet red from the sun. I couldn't find any aloe, so I pulled out the olive oil.
Oh, yeah?
Swabbed it all over my face. Nice. It took about 2 hours to absorb it all, but I got up Sunday morning and I had no redness.
Wow. And I don't know that I would normally say that, because you think of anything greasy on a burn is like putting, grease in a fire. So
I know you talked about it for skincare, though.
yeah,
And I thought I was going to try it.
as a moisturizer, olive oil is tough to beat. Other than what you said, it's a mess for a long, it stays around for a long time. But olive oil is very similar to our skin oils. So if you have dry skin and you want the cheapest, healing or cheapest moisturizing, olive oil is a great choice. I have lots of others. That's part of the cosmetic side.
Speaking of cosmetics, we got about a minute just to remind people of an event you have coming up.
The event is the peel party that we're doing the Thursday, September 20th. It will actually have appointments starting from about 3 p.m. to about 7 p.m. A lot of fun, about $400 worth of treatments. It costs $100 to be involved. And there's all kinds of specials for what you want to do going forward if you're part of that peel party. Bring a friend. We are almost full with this one. So if we get full in the next couple of days, there will be another one probably in about a month. That all depends on my board recertification stuff that I'm working on. And I'll tell you what, if you think life's busy, just add a little bit of recertification stuff into your regular life.
Good thing the government doesn't want anything out of physicians.
Hey, but remember, when you're so busy, remember to take a breath and say, you know what? life is still really too short not to feel good. So quit. Recognize you got a lot to do, but recognize you're able to do it, and that's a good feeling.
Want to thank the doctor. Tripp Family Medicine returns next week, Wednesday morning between 8:30 and 9 o'clock. On the way after the 9 o'clock news, Twin Falls City Councilor Suzanne Hawkins, right here on News Radio 1310 KLIX and newsradio1310.com.